So my third strand of thought is, how can we do something to shrink the existing tumours, both at the primary sites and at the secondary sites? Now I need to give a strong caveat for this following section, because it is untried. It is contrary to conventional thinking. Let us give ourselves a little freedom to think, to ask the question, how we might shrink the existing tumours. Well, my suggestion is that treatment is split into two phases. The first phase is to give the light-enhanced chemotherapy treatment whilst monitoring the number of cancer cells within the blood. Once a suitable combination of chemo and light has been devised, so that the spreading has been got under control, then the second phase is begun. The second phase is to shrink the existing tumours. Well, we can consider how to deliberately encourage the cells to break away from the tumours and to move via the blood system. It is to be noted that cancer cells can either be moving, in which case they are not multiplying, or else they are lodged at a site where they can multiply. In other words, they either move or they multiply. They do not do both simultaneously. So we need to encourage the cells to go into circulation. Of course, this is contrary to conventional thinking, where great effort is made to prevent the cells from breaking away from the tumour sites. So how do we do it? A very easy way to achieve this is to consider diet, and there are certain types of food which do indeed encourage cancer to spread. Certain types of oils and fats can increase the spread of cancer by 3 times compared to a low-fat diet. This testing has been done in the laboratory using mice and is described in the booklet. And so once the first phase, controlling the number of cells in circulation, is working, we can go on to the second phase, to shrink the tumours by actually encouraging the cells to go into circulation. I should again stress that this needs to be tested and tried in the laboratory first. Don't try this without the support of your oncologist. We need to now consider the design of the light source, and the first question to answer is, how far does the light travel through the skin? The diagram shown here shows that the shorter wavelengths at the blue end of the spectrum only travel a short distance into the surface of the skin. Then for longer wavelengths, the light travels for progressively longer distances. For the red light and the near-infrared, it travels into the small blood vessels near the surface, and so it is these wavelengths that have the potential to be of most benefit. We need therefore to produce light at predominantly the red end of the spectrum, and we need to produce the light efficiently to get high intensity using electricity from a standard wall socket. Here is a table of available light sources. The following pages describe the pros and cons of these available light sources. What are their spectra? Are there any particular difficulties? Can they be used in this application? And what is the efficiency? What is the cost effectiveness? So the different light sources have been considered, and it does seem that the required characteristics can be met by using a combination of 2 types of light source, as described in the booklet. Here is an artist's impression of the patient receiving the light at high intensity onto as large an area of skin as is practical. They are lying on a bed with the full body light source above them. So in summary, the red light, when pulsed on and off, very significantly increases the percentage of cancer cells which take up chemotherapy molecules. This has been demonstrated in vitro. It should not be confused with the existing techniques called photodynamic therapy, which operates on a different principle. 2. That tumour cells marked with different identifiers and placed into 2 different sites within a laboratory animal show an interesting behaviour of free-moving cancer cells. Cells from site A are detected at site B and vice versa, before any secondary sites are detected. The implication is that the initial condition for metastasis exists for some time before cells lodge at a different site, so therefore it would be very helpful if cancer cells could be attacked Effectively, whilst they are in transit, blood flows close to the skin and so offers an opportunity to attack these cells by light-enhanced chemotherapy uptake. 3. To have the potential to break up existing tumours, the cells can be encouraged to break away and enter the blood system. This encouragement of cells to break away and enter the bloodstream can be achieved by simply a change of diet to increase the intake of fats of particular types. There are also 5 areas of further study recommended within the booklet. The booklet is somewhat speculative and requires further in vitro measurements in order to tie up a number of loose ends. Nevertheless, the combination of these 3 pieces of information, when acted upon, could herald a new and useful weapon in the armory for the attack upon this old foe. Metastatic disease accounts for around 90% of cancer-related deaths. It is well worth pursuing further the approach that is outlined in the booklet. Thank you.